everyone, it's Nurse Mike here, and in this nursing entrepreneur video series, we're going to share with you guys, can you as a nurse or even a healthcare worker start your own home care agency? And the answer to that is a lot of nurses, a lot of healthcare workers, or even non-healthcare workers are starting to get into this home care industry. And the reason for that is obviously the baby boomers are coming. They're just coming in droves. Every day they're needing more and more assistance, and a lot of the seniors prefer to stay at the comfort of their own home. Now, before we even get started, I want to be able to differentiate two different industries within this area. There's the home care and there's the home health industry. Home health is the medical part of providing services at the comfort of the patient's home, and this is where we share and send skilled nurses, physical therapists, occupational therapists, social workers, and so forth. What we're talking about in this particular video is opening up a home care agency. And what that really is providing companion care, providing caregivers and homemakers to be able to help the patient at the comfort of their home. And usually, this is a private duty, and where the patient or their loved one will actually pay out of their pocket. Now, there are some insurances that are starting to cover these particular services, as well as even in Medicare Advantage. But we just want to be able to discuss what you need to do as a nurse, as a healthcare worker who actually wants to start your very own company and become an entrepreneur. So how does it really work? First thing you need to be able to find out is contact your state. You don't need to call them, you just need to be able to do a quick search. What are the regulations needed in your particular state regarding starting a home care business? Some states will actually require you to get a survey so that they can make sure that you have everything in place. Now, there are some states where they don't even need, or you don't need to be surveyed by the state surveyor. All you really need is your business license, and as well as your EIN, which is your federal tax ID number, and also get incorporated in your particular state. So let's go ahead and get started with all the basic things that you need to have, you need to put in place, you need to be able to gather that is typical with most applications. The first things first is get an incorporation. Any business that you create, you want to get an incorporation, whether it's an S Corp, a C Corp, or even an LLC. You do not want to apply for a business if you are going to be using what they call the SP, or self-proprietorship. The reason for that is because it puts you in harm's way. If there's anything that happens, like a lawsuit, it can go after your name. The reason why you start a new LLC, because they go after that company. Now, talking about lawsuits, you definitely need to be able to have certain things like insurance for your company. You need to be able to get a bond for your company as well. Those are some things. Now, each state is different. Some states require more, some states require less. Now, for the states that don't need a survey from a state surveyor, I truly suggest you also need to get insurance. It's just like your car. Do you really want to be driving around without insurance in your car? If something happens, like an accident, guess what? The insurance will cover it. Yes, you may have to pay a deductible, but at the very same time it still protects you as a person. All right. Now that we got the LLC part, let's say you figured out the whole application process. They sent you the checklist, the application, and you went ahead and wanted to get things started. So that within that checklist, typically you need to be able to have a policy and procedure. And once again, just to let you guys know, whether you need to be surveyed, you need a policy and procedure. This gives pretty much a map on how to provide the services within your industry. There are a lot of companies out there that that you can purchase your policies and procedures from. Our company over here, that I own, which is Home Health Success Academy, we sell the policies and procedures as well. But here's the thing, guys. You can start off with the policy and procedures, which is pretty much just a basic policy and procedures. But I truly suggest that when you get those, that you should be able to update it and also change certain things depending on what works well for you guys. All right. Now, looking into the whole thing, once you start having everything to set up, you put in your application, that starts going through. There's one thing in mind that you guys have to understand. You are now starting a business. It's a business. And a lot of problems that happens from healthcare workers is that all we think about is the quality of care, the great service we're going to provide the patients, the clients that we're going to be taking care of. Well, guess what, guys? You have to understand, that this is a business, and the only way to be able to make money in this industry is the way that where you have to actually learn how to sell and market your agency. Now, moving on, whether you need to be a train yourself, and we provide training for a lot of our clients. That's one of the biggest things that I do, for example, with homehealthsuccessacademy.com, is that we provide training to how to market your company correctly. But you don't really need to use that services if you're willing to network out there and do everything that you need to have. Now, you have to make sure you have your brochures. You have to make sure you have your website set in place. And just to let you guys know, if you guys create a website, don't just make a basic website that is pretty much just a digital copy of what your brochures are. Your website needs to be a data gathering site, as well as providing lots of value to the potential readers and the potential clients that you guys are going to be dealing with. The next thing you have to start looking into also is the pricing structure. Like, how much are you going to charge per service, okay? And a lot of people make the mistake of wanting to charge the lowest, thinking that when their price is the lowest, that they're gonna get the most patients. The problem is, you may have the lowest price, but if you don't do a good job of marketing and letting people know about that price, how are people going to actually want to start working with your company? So that's one of the biggest mistakes made. Also, when you lower the price, right, what happens is you lower the potential profits. And you have to understand there's a lot of things that you have to pay for in this industry. So you want to be able to put yourself smack in the middle of the pricing structure. Typically, we see out there people are charging $15 an hour to about $30 an hour for caregiving services. That's where we send a caregiver, a nursing assistant, to provide care at the patient's home. So moving on with that, right, once you figure out the pricing structure, just think about that, right? If you're only charging, let's say, $14 or $15 an hour, and your caregiver, you're paying them $10, after you pay taxes and all the things that you have to match, you might have a $2 or even a $1 difference profit. That's not a lot of money that you guys have. Once you have profit, don't forget you have to pay taxes later on with the government. Don't forget that. So, you have to be able to allow yourself, a big difference. Also, if you pay your caregivers a low rate, more likely they're just going to jump ship one of these days and go to another agency that's willing to pay them $15. And you don't want to have a large turnover ratio, a turnover rate in your company, because it's a lot harder than you think to be able to find caregivers out there. Okay, so we talked about several things already. The next thing you also need to start looking into is also finding a particular office, or where you want to be able to have it structured, wherever it is, right? For home care in some states, they allow you to have a home-based business and have the office at your home. There's nothing wrong with that. It saves you some money in the beginning. There's a tax break that you guys can get. But the problem with that is when you're hiring people, do you really want strangers coming into your house to put in applications? I would really think that that's something that you guys don't want. Other choices you can have is, maybe going into a strip mall type of a setup, or there's those office buildings where you can rent an office. And there's the fourth option, which is you can also do a virtual office where you're paying a small fee, typically about $99 to $199 a month. And what ends up happening is they allow you to use their address. And then if you need to have a meeting, they have meeting rooms that you can go in there and speak and talk to people that you're trying to hire for your company, all right? So that's just a good way to be able to figure out, where do you really want your office space? Equipments that you guys need for your office is really not that much. If you have a laptop, if you have basic, office supplies, that's really all that you need. You will do, some states will require you to be able to have what they call a fire safe storage room, or a fire safe storage cabinet. This is where you keep the patient's information so that it's actually stored correctly. So that might be required from you as well. Now, other than that, or if not that, you can also start looking at other things, right? One thing that I really enjoy in using are softwares or cloud-based softwares to be able to manage the patient's information, where everything is in the cloud and I don't have to be printing things out. So it's like a paperless environment. If I need to send something to a staff member, I can just send it to them, via the CRM system that we're using, the cloud-based system. So that's another option you should be looking at rather than doing paper-based, right? Because paper does get expensive. They do add up eventually. You're wasting time looking for paperwork sometimes. And so sometimes having a CRM or a customer relationship management system, especially the ones that are actually, concentrating and just dealing with the home care industry, and there are a lot of companies out there that you guys can look into that is pretty low cost, typically start you off at about $99 a month, even lesser. Okay, so once you have all that in place, you have to understand the one thing you need to do is, once you're approved, right? You just have to start networking out there. You have to start marketing. This is your business. You started from scratch. You should be doing something at this very moment to make sure that your company is running well, that you're marketing yourself out there. One thing I truly suggest when it starts coming for home care, for the non-medical aspect of things, because you can just go directly to the client, I would truly suggest start using Facebook marketing, YouTube marketing, as well as LinkedIn connections, because this will allow you to be able to gain more network and at the same time as introduce to people what you need to do about your company, what you do for people. These are things that you guys need to kind of set in place. For marketing wise, if you're one of those people that's old school and want to advertise, let's say for example in a newspaper or a magazine, hey, look, if you guys want to do that, go ahead and do it. But honestly, just think about it. When's the last time did you pick up a magazine? When's the last time did you pick up a newspaper? And did you actually go to page 37 and looked at this advertising on the bottom right? Okay. So what you want to do is you want to be able to hit the right people, the right message to be able to get them to want to work with your company. Now, when it comes to marketing, you want to market at certain places, like for example, nursing homes, hospitals. You want to go after assisted living facilities, memory care facilities, directly to the physicians, and even senior communities like those 55 plus condo communities or the 55 plus senior housings. Those are things that you need to be able to look into. Now, if we start looking at how much can you make, right? If we do just a basic math and start putting in our head, let's say you have 10 patients, right? Now, let's say each patient, you service them 8 hours a day. So if you look at that, 8 hours a day times 30, that's 240 hours of billable hours that you can do in a month, right? So let's just make it a plain even 200 hours billable, okay? So if you can bill 200 hours a month for one client, think about this. If you are making a $5 profit per hour, $5 profit, 5 times 200, that's $1,000 profit that you guys can actually have right there and then. That's when you already paid for the employee. You pay for certain taxes. You took care of certain things for the company. So now you have $1,000 profit. Now think about that for a moment, right? $1,000 profit for one client. If you can get 10 clients, a minimum of 10 clients, that gives you a $10,000 profit in a month, which within a year is $120,000 profit. So just having 10 patients, taking care of them all throughout, will get you about $120,000 a year. Now, a lot of people make the mistake that once they reach a certain goal, that okay, Michael, I just want to be able to make $200,000 a year and I'll be a happy person. I don't need any more patients. And once they reach that goal of making $200,000 a year, they stop marketing. And that's one of the biggest mistakes, because unfortunately seniors do pass away. Seniors do end up needing more extensive care, like going to the hospital, going to the nursing home, going to a long-term skilled nursing facilities. And so you will lose patients as time goes. So you want to be able to do what you're doing constantly and try to keep on increasing it. And if you really want to become successful, then one thing that you need to do is to be able to bring in a good team in your office. You have to understand that sometimes the people that you have in your office can only take you to a 20 patient census, and they can't be the part of the group that's going to take you from 21 all the way to 100. So you want to be able to make sure that you bring in the right people, you train the right people, and if you need to fire certain people, you need to fire them. All right, so that's just the basics of what I wanted to share with you guys. This is a good industry, especially if you're a nurse, a caregiver, a healthcare worker, or even not even a healthcare worker. So think about this type of stuff. Now, if you need help in regards to finding out what you need to do to be able to start this business, my team, for example, has amazing experience in this. We've done this for so many people already. Just stop by homehealthsuccessacademy.com. That's one of my consulting companies that I own, and so hopefully you can start looking into that and see if we can help you. But if you can do this on your own, look, guys, I did this on my own when I actually started my own agencies, and so trust me, without any consultants, I was able to figure it out on my own. Obviously, it just took a little bit longer and a lot more reading, and so that's why you hire a consultant. It just goes a little bit faster. But if not me, do it yourself, or there are other consultants out there that I would suggest for you guys to look into. You just have to be able to research it correctly. Now, if you guys want a basic guide, a full training of 14 modules, right? 14 modules that's going to be able to help you at least do it on your own by yourself, just to give you the base ideas. What you guys can do is go to 10xpatientreferrals.com, and we have an online program there that teaches people how to be able to market their home care, home health agency. And within the training, if you do it a month, the month to month, the lowest rate, which is like $79 a month, there's actually a full training program, a full module in there to teach you guys how to start your home care company so you don't actually have to hire a consultant like myself. So I hope this video gives you some hope and, helps you guys kind of make a decision. What type of business do you really want? As a nurse entrepreneur, what do you want to be able to do? What do you want to be able to start? Do you just want to keep on working as a floor nurse, or do you want to actually have something that you can create on your own? If you have any questions, comment down below, send us an email. I definitely want to be able to hear from you guys for me to be able to share my knowledge with you guys, and at the same time, just make it a community where people can share with each other. I hope you like this video. Subscribe. Please share this video if it means well to you, or if you know somebody that might want to hear this video. Thank you so much, guys, and you have a beautiful day.